Hi everyone, this is Dr. Usman. I made 5 videos earlier on YouTube on my channel. These are in Urdu or Hindi. Some of my friends asked me if I can just highlight the important points in a English, video in English. The first and the most important thing which we discussed was the difference between the coronavirus symptoms, cold symptoms, and flu symptoms. Let's start with the cold. Cold symptoms are usually with a runny nose, itchy eyes. You might have sneezing, a bit of cough, but dry cough, usually upper cough. You will not be feeling shortness of breath or really chest pains or discomfort in that way. So it usually involves the upper airway thing, and you might have body ache, but not as bad as you get in flu or coronavirus. Fever you might have, but not very common. With the flu symptoms, these are usually a bit more severe symptoms with cough, runny nose, and body ache, lethargic. You will be really drained out, and fever as well. So these are a bit more severe symptoms than cold symptoms. Talking about coronavirus, the symptoms of coronavirus are a wide spectrum of symptoms, starting with fever, cough, shortness of breath, but then it can cause body ache, headache, lethargic, feeling very malaise, and these things like that. So it's a very wide spectrum of symptoms, and as it's a new virus, so every day we do get to know new symptoms about this condition as well. Like recently, anosmia, which means loss of smell sensations, has been highlighted quite a lot, and a lot of people are reporting it as an important symptoms as well. Loss of taste sensation is another thing which people do report. Only 2 to 3% of the patients do have abdominal symptoms like abdominal discomfort or diarrhea symptoms. So that was about the difference of symptoms between three of them. Coming about the preventive measures, what should we do to prevent having the coronavirus? Which is the most important thing? The first and most important thing is the hand wash. Wash your hands as frequently as you can. Whenever you remember, just wash your hands, use soap, spend at least 20 seconds and rub the front of your hands, back of your hands, between the fingers, thumbs, wrist thoroughly, and then wash with the water. And then you can use the tissue to clean your hands and bin that tissue. Um, if you're outside and there is no water available, then you should be having a small bottle of sanitizer, hand sanitizer, which you can use if you're outside. Avoid rubbing your face, your eyes, your nose unnecessarily, and so a lot of people do have habit of doing it, so try not to do it. Try to change your habits. And then talking about the masks and gloves, a lot of debates going on. Things are not very clear at the moment whether how effective or how safe, uh, how much safety masks provide you in terms of prevention from the coronavirus. But if you are wearing the mask, I think it's more sensible thing to do, because a lot of new things do come up every day, and you never know. A month down the line, they say no, everyone should be wearing masks. So if that comes to a point where everyone, I mean, they say that, then it's better you're using it already. So if you're using the mask, keep using it. But it's more important at the moment. If you talk about the evidence, then it's more important if you have got the symptoms, or if you are a healthcare professional, or if you, I mean, looking after someone, if you're a care for someone, then you should be wearing the masks. Regarding the gloves, I mean, if you're keeping your hands clean, it's fine. You do not need to have the mask. So sorry, the gloves. It's not necessary to have the gloves as such. Again, one more thing about masks on its own will not provide safety to you. You still need to use the hand sanitizer, hand washing, and other preventive measures. um, Whenever you enter your home, for coming from outside, make sure you change your dress straight away, and have a shower before you get to see your family. Keep your shoes in a rack just at the front door as well, and everything it should be uh, taken care of. In terms of the further, any medications which you can take to prevent yourself from coronavirus? And no, there is no medication which will prevent you, but if you there are a lot of things which actually boost your immunity, and that's very important. You should have a very good immunity, because if the virus enters your body, you need a strong immunity to fight against that virus. And because if you're able to fight against the virus, you will survive. So a lot of things which helps in boosting your immunity, I would broadly categorize them into diet and supplements. Talking about the supplements, you can take any multivitamin supplements. Make sure it contains vitamin C, vitamin D, and zinc. So these are more important, but yeah, I mean, multivitamins you should all be taking. Talking about the diet, a lot of things in the diet, especially the citrus fruit, they do contain a lot of vitamin C, so lemons, oranges. Honey is good generally for health. So yeah, you can include honey, black seeds, a lot of people are saying about it. Spinach, broccoli. 5 small broccolis a day is actually equal to 1 tablet of iron tablet, so it's a very good healthy diet. Almonds are good. So these are some things in your diet which actually boost your immunity. Treatment: if you have the symptom, the first and most important thing is to self-isolate yourself. uh, and when we say self-isolation, is it's 7 days if you have symptoms, and if you are self-isolating, everyone else at your home has to be self-isolate for 14 days as well, even if they don't have symptoms, because the virus incubation period is about 2 to 14 days. So it may be possible that they do catch up virus from you, but they do not show up any symptoms up to 14 days after catching up the virus. So they all should be self-isolating as well for 14 days. um, Paracetamol you can take. It will help you with your controlling your temperature, help you with body ache, muscle ache, headache. So paracetamol is a good tablet for that, and probably the most safest one. A lot of myths about ibuprofen, whether you should be taking it or not. As we speak today, 2nd of April, no evidence that you cannot take ibuprofen. So yes, you can take ibuprofen, but keep it as a second line. Paracetamol is your first line. Hydroxychloroquine, which is used to be a very common anti-malaria in the past, but not used as an anti-malaria now, but used for some other conditions. But a lot of research has been going on about hydroxychloroquine. There are 3 active clinical trials going on in UK as we speak. But as of now, there is no evidence in the UK, because the control trials are still going on, so we cannot say that it is not licensed to use for coronavirus. In some countries, I understand it has been used, and but make sure if you are taking it, take it on doctor's advice. Don't self-medicate yourself. It's not a very safe medication. It may cause heart arrhythmias, and it may not be safe for your heart. So make sure if you are taking it, take it with doctor's advice. Don't take it on your own. Azithromycin is another medication. People do say it's good for in combination with hydroxychloroquine, but both these medications within are taken together, they can cause heart arrhythmias. Again, something which is, so you need to be careful of, and please don't take any medication without doctor's advice. So in short, if you have symptoms, try to speak to your doctor. You don't need to go and see your doctor. You can speak over the phone. It's different in different part of the world. In the UK, you can call 111. You can do online. You can just go to 111.nhs.uk and / covid-19, and it will take you step by step about your symptoms and will tell you what to do at the end. Or you can speak to your GP. Try not to go to the hospital for every small illness, because the risk of catching the virus is more rather than the virus symptom itself. So better to speak to someone. And last but not the least is the social distancing. Everyone, please stay at home, stay home, stay safe. If you only go outside, if it is really necessity, only for necessity shopping or grocery, and even if in that case, please follow the guidelines locally, and cooperate with the shop owners or the utility stores owners, and please take care of yourself and take care of others as well. Alright, take care then, bye.